India has 12 million blind people, highest in the world. 80% of this blindness is avoidable. 300,000 children in India are blind. 50% of this blindness can be prevented or treated. Despite progress on many fronts, blindness remains a huge challenge in India. 75% of Indians living in villages and underdeveloped areas do not have access to basic eye care services. North Bengal is one such region. In the vast tea garden areas and remote villages, thousands of people are suffering from blindness that is avoidable and treatable. There are very few eye care service providers in North Bengal. Most of the eye care providers do not reach out to rural areas where prevalence of blindness is very high. Siliguri, a small city, has become the hub of North Bengal for all important activities: business, agriculture, tourism, and most importantly, healthcare. People from neighboring countries of Bangladesh and Nepal and Indian states of Sikkim, Assam and Bihar also depend on healthcare facilities in Siliguri. In the early 1980s, the situation of eye care services was much worse. It was a big concern for the members of Lions Club of Siliguri Greater. The club was already doing several social activities in this region.
उन दिनों इस एरिया में आँख के पेशेंट बहुत थे और उनको दिखलाने की कहीं सुविधा नहीं थी। तो यहाँ के कम्युनिटी की नीड को देखते हुए हम लोगों ने, क्लब मेंबरों ने सोचा कि एक आई हॉस्पिटल बनाया जाए। उसी उद्देश्य से हम लोग आई हॉस्पिटल की तरफ हम लोग आगे बढ़े। हमारी जब क्लब बनी 1981 में, हम लोगों ने एक ब्लड डोनेशन कैंप ऑर्गेनाइज किया। सब मेंबरों ने उसमें ब्लड दिया और उसी दिन हम लोगों ने प्रतिज्ञा की कि हम लोग आई हॉस्पिटल बनाएंगे और बृहत आई हॉस्पिटल बनाएंगे इस एरिया के लोगों के लिए। हम लोगों ने ज़मीन ली और जो ज़मीन हम लोगों ने ली, सब मेंबरों ने कंट्रीब्यूट किया। जो दानदाता थे उन्होंने आधी ज़मीन हमें दान में दे दी और आधी ज़मीन हमने उनसे खरीद ली और उस पर हम लोगों ने हॉस्पिटल बनाने की परिकल्पना की। हम आगे बढ़ते चले।
Today, Siliguri Greater Lions Eye Hospital is the most preferred destination of all blind and visually impaired persons of this region. Let us have a look at what has been achieved in the last 30 years. The hospital receives all categories of patients, those who can pay and those who can't pay. All patients are seen by same paramedics and the same doctors and by the same equipment.
In all patients, whatever be the problems, the patient requires to have a dilated fundal examination. This is a routine procedure for everyone. Everyone requires to go for a IOP examination and whatever be the complaints. Presently, we are maintaining electronic medical record system. Through those record systems, we can monitor the patient's waiting time very nicely. Without asking anybody, I can see where my patient is waiting for the examinations and who is examining what. These are all of the indicators of the waiting time. If the waiting time increases, the color code will change and we will be able to identify the patient is waiting and where he is waiting.
First, the patient undergoes complete refraction and tests. Then the patient is referred to the respective doctors. If required, doctors advise the patients for a dilated eye exam which requires extra time. But it is essential for fundus examination. Once the patients are seen by the doctors, if necessary, investigations are required. They are sent to the diagnostic facility. The hospital has all advanced diagnostic and treatment facility, including OCT, FFA, perimetry, A scan and B scan. It has a laboratory and a medical officer for performing necessary health checkup and diabetes consultation. There is a dedicated patient counseling section for explaining patients about eye conditions and need for appropriate treatment. Admission formalities are completed in the admission department before surgery.
This is a child-friendly department. We have made such a thing that so that child will be comfortable here, and he will not feel that he is in a hospital. He should feel like he is in a park. He is playing and there is a toys.
Almost every day, the hospital conducts a screening camp in rural areas and tea gardens. It collaborates with local Lions clubs and NGOs for organizing these camps. Government health workers like Asha and Anganwadi teachers help in organizing special camps for children.
আমরা তো সচরাচর বুঝতে পারি না যে কার কি প্রবলেম আছে, এরা এখানে আইডেন্টিফাই করার পর এক্স্যাক্টলি বুঝতে পারবো আমরা। আর যারা মানে এই সব এলাকায় বাবা মারা বেশিরভাগই মানে শিক্ষার হার কম থাকায় ওরা ঠিক বুঝতে পারে না কোন সময় চেক আপ করানোটা সুবিধা হবে, যাতে বাচ্চাদের আর্লি ফার্স্ট মানে ট্রিটমেন্টটা ভালো হয়, সেই জন্য এখান থেকে বলা হচ্ছে আর আইস ক্যাম্পে ওখানে রেফার করা হচ্ছে।
और गांव-गांव में घूमकर डायरेक्टर से कांटेक्ट करती हूं और डेट लेती हूं और कैंप करती हूं, और कैंप करने के बाद जितना ऑपरेशन के लिए जाते हैं या तो किसी को ज़रूरत पड़ता है वहाँ जाने के लिए उनको लेके जाती हूँ, और वहाँ से दिखा के वहाँ से चश्मा लेते हैं, और जिसके लिए गांव में ज़रूरी है उनके लिए गांव में ही चश्मा दे देते हैं। इससे हम लोगों को बहुत सुविधा हुआ। बहुतों को सिलीगुड़ी जाने के लिए कोई नौबत नहीं आई, यहीं पर आकर चश्मा पहनने लगे और अपना काम सुविधा से करने लगे।
हम लोग का हॉस्पिटल में दवा खा खा के परेशान हो गई मैं, तो 9th क्लब से यहाँ पर कैंप बैठा है ना, उस समय हम लोग भी गए, कोई गए कोई नहीं गए। उस समय हम लोग गए तो इलाज हुआ तो चश्मा दिए, चश्मा दे दिए तो दवा भी दिए साथ साथ में, तो दवा भी लगाए, बाद में खाने के लिए भी दिए थे। बाद में अभी तो पहन के हम लोग पत्ती टीप सकते हैं ना, अच्छा दिखाई देता है। पहले तो उठाने नहीं सक रहे थे उस समय, अभी तो ठीक से उठा सकते हैं हम लोग।
मैं पहले बिल्कुल देखने नहीं सकता था, वो खड़ा होकर नीचे का कुछ नहीं दिखाई देता था। फिर ड्रेन बड़ा छोटा जैसे लगता था, उसको पार करना आपको मुश्किल होता था। अभी हम सुना है कि लायंस क्लब से और डॉक्टर लोग आए हैं, वो तब फ्री में ऑपरेशन हो रहा है बोला, तो हम गया ऑपरेशन कराया, तो अभी काम करने में सुविधा होता है, अभी अच्छा से काम कर सकता है अभी।
The hospital has also set up vision centers in rural and tea garden areas so that the needy community can access primary eye care services. Patients identified with eye problems are brought to the hospital for eye surgery. There is no difference in clinical care. All patients are operated by same surgeons with the same set of equipment. Single room theatre with single table and rigorous protocol ensure higher standard of care.
More than 60% patients, those who are admitted in our hospital, in fact they are getting the treatment free of cost. Our organization is a charitable organization, but we don't compromise on the quality and the care. I can very well say that the patients are getting best possible care and ambience in the hospital, maybe at par with the private hospital or maybe better than that.
There are different facilities for hospital stay, from general ward to deluxe cabins. Trained nurses provide 24/7 services to ensure best possible comfort and care to each patient. There is a dedicated daycare facility for patients who are not required to stay in the hospital. There is a medicine and optic shop within the hospital where all kinds of eye-related medicine and spectacles are available. Best quality spectacles are available in the shop at a very low cost. Contact lens service is also available in the hospital. Along with service delivery, the hospital does invest a lot of resources in training of eye care personnel for this region. In collaboration with IGNOU, it offers BSc in optometric course. Other courses include 1-year course in vision technician and ophthalmic assistant.
We could not have achieved so much or reached so far without support from Lions Clubs International Foundation, which is world's #1 service organization. We are also grateful to the large number of international institutional supporters who have helped us to reach this level and develop this institute in this underdeveloped area of the country. We can name a few of them like Operation Eyesight Universal, Canada, Orbis, World Diabetic Foundation, and so on. LCIF has nurtured us from the very beginning, and we are extremely grateful to this organization.
Initially, the focus was only on conducting eye screening camps in rural areas. Gradually, infrastructure was strengthened. This has generated awareness among people and created demand for services. In 2005, thrust was given on strengthening human resources and improving clinical quality. This led to the increase in paying patients and achieving self-sustainability. The next stage was introduction of specialty services like retina and pediatric eye care. Today, Siliguri Lions Eye Hospital is the largest eye care provider of North Bengal, and it has also started training eye care personnel for this region. However, there is a long way to go. The hospital is able to reach out to only 2% of the total blind people of this region. A huge number of people still suffer from blindness that can be treated or prevented. Siliguri Greater Lions was the first eye hospital of this region to join Vision 2020 for a collaborative effort to eradicate blindness from this part of the country.
When you have the determination, change is possible. We have the capacity to do more than what we are doing, and we are committed to reduce avoidable blindness in this region. We would positively like to become a center of excellence that provides eye care services that is available, affordable and accessible for everyone.